Guys, welcome back to another session of Know Your Bones. If you're somebody who has low backache or you're somebody who wants to know about low backache, you have come to the right place now. I'm Dr. Santhosh Jacob, an orthopedic surgeon from the city of Chennai, Tamil Nadu, India. And today we are going to talk about low backache and what else low backache could be. Could low backache only come from the spine, or could it come from any other bone or any joint which is lying close to the spine? That is what we will be seeing in this session. Today the story I'm going to share is of a 26-year-old lady patient of mine. Now this was a patient who was being treated by me for low backache for the past 7 years. She used to have low backache on and off, but she used to rest and the pain used to disappear. Whenever it used to come back, which was 3 to 4 times a year, she used to take painkillers, do physiotherapy and rest, and then start off as if nothing had happened. She had gotten used to living with the pain, and then something peculiar happened 4 months ago. She had one severe episode of pain where she was just not able to move, and the pain was also radiating to the buttocks and to the back of the leg. She had also developed an episode of fever, and her low back was feeling warm, she said. So they brought her to me in an ambulance. She was unable to walk. It was that severe. So I spoke to her and I told her clearly that even though her x-rays seemed more or less normal at this point of time, an MRI would be a very good idea. But I also told her that as the pain is radiating, she might have a problem in the spine like a disc bulge, but an MRI will show us clearly if there is any other joint involved. Because of the fever and the warmth in that region, I suspected that it could be an inflammation of a joint which is just below the L5 region, which is known as the sacroiliac joint. Now, the sacroiliac joint is a joint which is between the sacrum, which is a triangular bone, and the ilium. What is this guy talking about? Please don't worry, I thought about it. And I have a surprise for you. So now if you see, this is your pelvis. This is your pelvis from the front. And as I move down, you can see the sacroiliac joint at the front. The triangular bone I spoke about is the sacral bone, and that is the sacroiliac joint. Now, when I turn the bone at the back, you can see that the sacroiliac joint, you can see the sacroiliac joint here. Yeah. Now, this sacroiliac joint connects with the L5 at this point, this close it is. So from the back, if you see, this is the sacroiliac joint and your L5 comes at this region, and this is your lower back. Now can you see why it would be so confusing for anybody to describe the pain or to diagnose the pain without a scan? Because an X-ray does not show early inflammatory changes or just inflammatory changes at all. That is why sometimes a more advanced investigation like an MRI helps us clear the diagnosis. The MRI scan results of the patient came and her spine was completely normal. She had an inflammation of the sacroiliac joints. Now, inflammation of the sacroiliac joints is known as sacroilitis, and it is a very common cause of low back pain in young adults. So sacroilitis is basically inflammation of the sacroiliac joints. Pain could be just in the sacroiliac joints at the back, or sometimes even at the L5-S1 junction. You guys have heard the L5-S1 mentioned many times in the doctor's office. So S1 stands for the first bone of the sacrum. So L5 comes on top, then there is a disc here, and then comes S1. So an L5-S1 disc bulge signifies a disc bulge at this junction. One of the reasons why I wanted to discuss sacroilitis, it is one of the most commonly misdiagnosed reasons of low back pain in young adults. Reason why I am making this video is, if you know what to tell your doctor, it will be easy for your doctor to diagnose right. And when we diagnose right, most of the time the treatment is very simple. And when we diagnose early, most of the time it is non-surgical. So this is why you need to learn about your symptoms to make yourself a harder target once again. What are the causes of sacroilitis? 1. Ankylosing spondylitis. It is an autoimmune disease and it is a progressive inflammatory disease. That is, as the disease and your age progress, the pain symptoms will increase. It basically makes all the joints in your body stiff. So if you have ankylosing spondylitis, apart from pain in the lower back, which could be sacroiliitis, you will also have stiffness in all the other joints in your body. Next thing is osteoarthritis. Osteoarthritis is basically because of wear and tear. Osteoarthritis of the sacroiliac joint is generally seen in age above 50 and in those who have had an injury in that region, and that is called traumatic osteoarthritis of the SI joint. So traumatic means degeneration of the sacroiliac joint caused because of an injury in that region. That is a pathological cause of osteoarthritis. Many times osteoarthritis is just a degenerative process because of the amount of work we have put the joint on. Pregnancy and infections of the sacroiliac joint are also a cause. Apart from that, in immunocompromised individuals, immunocompromised in the sense those who have uncontrolled diabetes or any pre-existing comorbidities which make them susceptible to diseases. In those patients, sacroiliitis can also be triggered by a simple urinary tract infection. This is very common in diabetics whose sugars are uncontrolled. So this is another thing you have to keep in mind. And the clinical symptoms: pain in the region of the lower back. Sometimes it might even radiate to the buttock and the upper thigh, confusing it with another very common symptom called sciatica, which is also pain in the lower back, but it radiates to any length, mostly in the back of the thigh. Could be to the buttock, could be to the knee, could be to the ankle or to the tips of the toes. Sciatica happens because of a disc compressing the sciatic nerve roots. One classical clinical symptom, if it is present, with which you can easily distinguish, is presence of warmth in that area and fever. If there is inflammation along with fever, most of the time you will have to lean towards sacroiliitis or an inflammation in that region rather than a disc bulge. A disc bulge is preceded by some stressful activity like lifting weights or walking for a long time or playing some sports without stretching. It is a very common reason I have seen for aggravation of disc bulges. Finally, as the pain progresses in a disc bulge, you will see that the radiation of pain is more. But in a sacroiliitis, there will be pain in the lower back, in the lower thigh. But as the day progresses or as time progresses, you will see that the concentration of pain is in the sacroiliac region, the place where I showed you. That is another difference which you should know, because you have a sacroiliac joint and you have an L5S1, and you should be able to distinguish where the pain is coming from, and that will be of immense use in history taking for us doctors. Diagnosis clinically is very difficult, as the lumbar region and the sacral region are so close to each other. So you can differentiate a sacroiliitis with the itis. Itis is inflammation. So if there is warmth there. A disc bulge is not an inflammation. It is a problem caused because of pressure symptoms. The disc pressing on the spinal cord. An X-ray will not be of much help here unless it is a very advanced case where you can see osteoarthritic changes on the X-ray. But an MRI will classically show accumulation of fluid in between the sacroiliac joint, and that is the best way to identify sacroiliitis before it turns into any chronic pathology. By chronic, I mean long-term problem. So is there any other way with which we can differentiate if it is a disc issue or a sacroiliac issue? Say if one of you is anxious about doing an MRI, there is a clinical test where under live X-ray imaging, we can inject local anesthesia into the sacroiliac joints. Under X-ray vision, when you see the sacroiliac joints and you inject it right and the pain disappears, more or less clinically you know that the pain is rising from the sacroiliac joint. Because if the pain is from the disc, injecting local anesthesia in the sacroiliac joints will not help and the pain will persist. This is a clinical test done sometimes even now. I do it even now if my patients are anxious about an MRI scan. Treatment options: I would advise you to rest if you have an episode, ice it and heat it, alternate heat and ice. If the area is warm, ice it. Once you ice and it becomes really cold, heat it up. Because alternating heat and ice increases the blood circulation in that area. When there is blood circulation, there is healing. Over-the-counter painkillers, massage balms, local applications. I, for one, do not advise over-the-counter painkillers because there are few organs which you can replace. Your knee you can replace, your hip you can replace, but your kidney and your liver you just cannot replace. Yes, there are transplants, but the success rate and the stress you have to go through is very high. So do not abuse analgesics. All analgesics metabolize through the liver or through the kidney, and they require a lot of enzymes for them to work. So every time you take an analgesic, you put stress on your liver. So the more stress on your liver, when it is already in stress because your body is in pain, is not good. So as far as possible, use physical methods of pain relief and ask your doctor if you need pain meds. Please do not abuse them as they are available easily. So now, coming to the interventional treatment, say if you're on medication, physiotherapy, exercises, nothing helps. What can you do? We can inject platelet-rich plasma or mesenchymal stem cells. Basically, platelet-rich plasma or PRP is your blood harvested and concentrated into healing and growth factors, basically anti-inflammatory factors, and it is injected and under ultrasound guidance. I see the joint under both ultrasound and X-ray vision, and I inject it right in the area of the SI joint, and the success rates are very good. There is no scar, no incision, and it is also done under local anesthesia as a day care procedure. Advantage with injecting stem cells or PRP is that it is your own body's cells. We do not use any other pharmaceuticals inside the joint. So I believe that if you can naturally reduce inflammation using your own blood products, you are not altering anatomy. It is concentrating your healing factors and injecting it in a region of pain and inflammation to reduce inflammation. So it is the most natural way we can combat any inflammation in the body, and this principle applies to a lot of issues. We also do implantation of electromagnetic devices which numb the nerves in the sacroiliac joint. I am not a big fan of that. I believe that regenerative orthopedics is the future and that we should use stem cells especially for anti-inflammatory effects, as they do not give any side effects and the possibility of rejection is very less. Finally, if nothing works, we can fuse the joint. It is a major surgery, so I do not advise it. So I encourage you, wherever you are, to talk to your doctors about platelet-rich plasma or PRP. I know for a fact that doctors all over the world are doing it. You just have to find a doctor who understands it and knows how it will help you and why it will help you. And trust me, it is a solution for many of the problems we have created in our body because of our lack of activity and bad postural manners. So that was low back pain and sacroilitis, how to differentiate it. I hope it was helpful. I thank Mrs. Sendil Satyabama who brought this interesting topic to my mind. Thank you very much. If any of you want me to talk about a bone, just comment, know your bones and the bone or the bone disease you want me to talk about, and I will be very happy to talk about it.